The international body that oversees the World Health Organization is holding a key meeting today. The two-day gathering will look at the WHO's response to the coronavirus pandemic. Now, Lynette Ong is an associate professor of political science at the University of Toronto's Munk School of Global Affairs and Public Policy. Lynette, always enjoy having you on the show. Thanks for joining us. We should tell you...
Hello, John. How are you?
Good, thanks. We should tell you that we are listening in to that, and the Canadian representative is going to speak at any minute. So if I interrupt you, please don't take it personally and stay with us, because we'll come back to you to get some reaction afterwards. But let's begin by talking about the significance of this meeting.
I think it is very significant because, if you look at human rights abuses in the past by China, there's always been a problem to collect consensus from a lot of countries because of collective action problem. Everyone wants to enjoy the benefits, but no one wants to pay for the cost of economic coercion. But in this pandemic, everyone has actually suffered. So that collective action problem has largely been resolved. So now that we have more than 100 countries agreed to press WHO for an independent inquiry, I think is a very significant event.
Let's talk about the non-involvement of Taiwan, wanting to be there, not getting invited to today's meeting. Let's talk about the significance of that.
Taiwan doesn't have formal diplomatic status. China sees it as a renegade province and is not recognized by the United Nations. But we know that Taiwan has done actually very well in fighting this virus. So a lot of lessons are actually lost. So I think Canada is right that it's supporting Taiwan's admission to WHO, even not in a formal way, but some sort of recognition to allow Taiwan to share its experience and the rest of the world to learn from it would be very beneficial.
We've seen almost from the very beginning of this crisis the mixing of medicine, science, and politics. We're seeing China pledging $2 billion over 2 years to help with the COVID-19 response. We know that U.S. President Donald Trump has essentially said that he will withdraw funding for the WHO. Let's talk about the tensions between China and the United States and the effect it could have on all of our health.
It is actually very unfortunate because we really need, ideally, we need the two powers to collaborate in order to find a collective solution. But with the withdrawal of U.S. leadership, China has stepped up. And that has actually allowed China to shape the global narrative of how it is actually fighting the pandemic, that it is actually helping the rest of the world, particularly developing countries, to do so. China has rightly come under criticism for doing that. But let's not forget that it is really the hollowing out of the U.S. leadership that is allowing China to do so. So I think both countries are at fault there.
We've seen China defend its handling of coronavirus. Xi Jinping saying, I'm going to quote from that, "All along we've acted with openness, transparency, and responsibility." It may be too early to say whether you agree or disagree with that, but what do you think in terms of investigating China's role and how transparent it has been?
The nature of this very political system, I think, suggests that transparency has always been an issue. Information control is an intrinsic part of an autocratic system. There has been cover-up at the beginning of the virus outbreak, and that has been widely reported by Chinese journalists as well as by foreign media. And even Beijing has actually nationally, officially declared Dr. Li Wenliang as a hero, and he was seen as a whistleblower. So even Beijing has acknowledged that problem. But on the other hand, President Xi is now saying to the rest of the world that it is being transparent. I think it is contradicting himself.
Do you think that the WHO has been harmed in its credibility because of the debate over China either withholding information or the WHO itself?
I think so. But WHO is an organization. It is as good as collective parts of its members. So it could only go along as far as its members allow it to do to do so. So China at the epicenter of the outbreak, I think the WHO needed to maintain certain sort of relationship with China to allow the organization staff to go into the countries to do some investigation. But I think there's also arguments to be made that it needs to question and maintain certain degree of distance from China to maintain impartiality in order to boost its credibility. And I think on that front, it has rightly come under criticism.
Finally, in this debate that we're having about China, the United States, and the WHO, what worries you the most?
What worries me the most is two things, really, as I said before, holding out of U.S. leadership. And now, more than ever, we need the West, a champion from Western liberal countries to stand up. And I think no country has the clout except the United States. And given the vacuum, China is stepping up in terms of financial contribution and everything else. And a lot of developing countries are not in a position to resist that because they need the technical capacity, they need the technical assistance. So we can't really blame the developing countries for buying into China's narrative when they have no other options out there. So that is actually the thing that worries me the most.
Lynette, thank you again for your time. Really appreciate it.